Now at 4:30, more now on the return of masks across the state. Right now, Governor Lamont and the Department of Public Health are recommending that people wear masks in public indoor areas, even if they are fully vaccinated. In response, more cities and towns across the state are announcing mask mandates. Joining me to talk more about this is Dr. Carl Mingus, Interim Dean of the School of Health Sciences at the University of New Haven. Dr. Mingus, thank you so much for joining us.
Sure, thanks for having me.
So thankfully, we're in the summer right now and it's August, so it's warm outside and there are a lot of outdoor activities that we can do with friends and family. But of course, there are always those indoor opportunities like dining and things like that. What indoor activities should people consider risky, do you think?
Yeah, really anywhere that you thought may have been risky prior to vaccines being a real thing, right? So we're thinking about grocery stores, places where you're likely to engage with and come across many people that have less of an opportunity for social distancing. And I would add schools to that list as well, especially because for the younger children, they're unable to be vaccinated at this point in time.
There is a lot of confusion right now. There are a lot of questions about the fact many of us are vaccinated and are now being asked to wear the mask again. Do you think masking up indoors really makes that big of a difference?
Yeah, absolutely. I mean, time and time again, research has shown that this is an airborne virus that spreads through droplets, through aerosols, and really wearing a mask is the best way to prevent you from inhaling, right, this virus. So it is crucially important. Masks next to vaccinations are the most important thing to prevent the spread of COVID-19, and importantly, the Delta variant. Keep in mind, that's why we're all going back to the traditional method of wearing masks in crowded public spaces.
So beyond getting vaccinated and masking back up, as you mentioned, is there anything else that people can do to try and protect themselves right now, especially from this very contagious Delta variant?
Yeah, I would say just think back to your playbook, right, of what folks have been doing for the greater part of the last 15 months or so, especially before vaccinations were possible. So plan on having small gatherings where you don't really extend beyond the core of your family. If there's an opportunity to go into a public space, make sure you sanitize, wash your hands, maintain the distance that you can. Try to visit places like the grocery store at off times that are less likely to be busy. We do know more about this virus, but the reality is that the Delta variant is very transmissible, and even people who are vaccinated can transmit it to others. So that's why we're going back to some of the basics for now. And hopefully as vaccinations tick up across the country and regionally and locally, we will be able to reduce the mask guidelines that are currently standard.
And lastly and quickly here, I wanted to ask you about a third booster shot. Obviously, there's been a lot of talk about it. Pfizer wants everyone to get one. The CDC and the FDA have so far said that they do not approve of one. What are your feelings on that?
Yeah, so until the FDA really releases strong guidance one way or another, it really is not a certain thing as to whether or not a third dose would be required. Realistically, the vaccines are doing what they're supposed to be doing. They're preventing folks from being hospitalized or dying from even the Delta variant of COVID-19. So it's very important to think about what it's doing to protect us. And for now, the 2-dose regimen seems to be working. But there are people that have been in these trials that have had this vaccine for well over a year now. And that's really who they need to be following up with to see, does it maintain its efficacy? Is your immunity still boosted as a result of having this vaccine? Or do you need a booster, much in the way that you would need a booster for other common ailments?
A very good point. There's still a lot of unanswered questions, but we definitely appreciate your insight and all of the good information that you gave us as we continue to navigate this never-ending roller coaster together. Dr. Carl Mingus, thank you so much.